Part 3, B, Medicare, more than just turning 65. Before we can talk about changing America's healthcare system, we need to understand another major piece of the system already in place. Most Americans have heard of Medicare. Many are enrolled in it. Others have helped a parent, spouse, or friend navigate it. Almost everyone has heard the basic explanation. When you turn 65, you go on Medicare. That explanation is not wrong. It is just incomplete. Medicare is much more than a healthcare program for people over 65. It is a large and complex system that has evolved over nearly 60 years, combining federal government coverage, private insurance options, and individual choices. Like Medicaid, Medicare was created in 1965 as part of the expansion of healthcare coverage in America. But while Medicaid is a partnership between the federal government and the states, Medicare is a federal program with the same basic rules across the country. Whether someone retires in Oregon, Ohio, or Oklahoma, Medicare operates under the same federal framework. That is one of the biggest differences between Medicare and Medicaid. Medicaid is primarily based on income and need. Medicare is primarily based on age, disability status, and certain medical conditions. Most people qualify because they reach age 65. Others qualify because they have received disability benefits long enough to meet Medicare requirements, or because they have specific conditions such as end-stage kidney disease or ALS. Your bank account does not determine eligibility. Your age or medical circumstances do. Medicare is not one single program. This is where Medicare becomes more complicated. Many people assume Medicare is simply one insurance plan provided by the government. In reality, Medicare is a collection of different parts that cover different areas of healthcare. It is a little like being handed several menus at a restaurant and being told to build your own meal. The choices are there, but understanding how they fit together is not always simple. The major pieces are parts A, B, C, and D. Part A, hospital coverage. Part A is often called hospital insurance. For most people, there is no monthly premium because they already paid into the system through payroll taxes during their working years. Part A helps cover major medical events, including inpatient hospital stays, limited skilled nursing facility care after a qualifying hospital stay, hospice care. However, like almost every part of healthcare, the word covered does not mean every expense disappears. Deductibles and other cost-sharing requirements still apply. Part B, medical coverage. Part B covers many of the healthcare services people use outside the hospital. This includes doctor visits, outpatient services, preventive care, medical equipment such as walkers, wheelchairs, and other medically necessary devices. Unlike Part A, Part B generally requires a monthly premium. Most people pay a standard amount, although higher income beneficiaries may pay more through income-related adjustments. Together, Parts A and B make up what is commonly called Original Medicare, but that is only one way to receive Medicare coverage. This is where Medicare begins to look less like a single program and more like a collection of choices. 2 paths through Medicare. Once someone enrolls in Medicare, they have an important decision to make. They can stay with Original Medicare and add supplemental coverage, or they can choose Medicare Advantage. Both approaches are part of Medicare. They simply organize coverage in different ways. Original Medicare. Original Medicare includes Parts A and B. One of its biggest advantages is flexibility. A person with Original Medicare can generally see any healthcare provider in the country who accepts Medicare. There are no traditional insurance company networks limiting choices in the same way many private plans do. The trade-off is that Original Medicare does not cover every cost. There can be deductibles, coinsurance, and other out-of-pocket expenses. In many situations, Medicare pays its share, and the patient is responsible for the remaining amount. That is where Medigap enters the picture. Medigap is private supplemental insurance designed to help cover some of the expenses that Original Medicare does not pay. The federal government standardizes many Medigap plans, meaning that a Plan G from one insurance company provides the same basic benefits as a Plan G from another company. The differences are usually the monthly premium, customer service, and the reputation of the insurance company. For many people, Original Medicare combined with a Medigap policy provides predictable costs and broad freedom to choose providers. Medicare Advantage. Medicare Advantage, also called Part C, takes a different approach. Instead of receiving Medicare benefits directly through the federal government, beneficiaries choose a private insurance company approved by Medicare to manage their coverage. These plans often combine hospital coverage, doctor coverage, prescription drug coverage. Many also include additional benefits that original Medicare does not normally cover, such as dental, vision, hearing benefits, and wellness programs. For many people, that combination is attractive. Some Medicare Advantage plans have very low monthly premiums, sometimes even no additional monthly premium beyond what they already pay for Medicare Part B, but lower premiums can involve trade-offs. Most Medicare Advantage plans use provider networks. Some services may require prior authorization, meaning the insurance company reviews the request before agreeing to pay for certain tests, procedures, or treatments. The advantage is that these plans include a yearly limit on out-of-pocket costs, something original Medicare does not provide by itself. The choice between original Medicare and Medicare Advantage often comes down to priorities. Some people value flexibility and the ability to see almost any Medicare provider. Others prefer the convenience of having more benefits combined into one plan. Neither choice is automatically right or wrong. They simply represent different ways of balancing cost, flexibility, and control. Part D. Prescription. Drug coverage. Prescription medications became another major part of Medicare with the creation of Part D in 2003. People with original Medicare can purchase a separate Part D prescription drug plan. Many Medicare Advantage plans include prescription coverage as part of their package. Because private companies administer these plans, each one has its own list of covered medications. A prescription that is inexpensive under one plan may cost much more under another. This is why choosing a Medicare plan involves more than looking at the monthly premium. The medications someone takes and the doctors they use can be just as important. What Medicare does not cover. One of the most common misunderstandings about Medicare is that once someone turns 65, all healthcare expenses are covered. That is not how Medicare works. Medicare generally does not cover many services that people often assume are included, such as routine dental care, routine vision care, hearing aids, long-term nursing home care. Those gaps are one reason some older Americans need additional coverage or eventually qualify for Medicaid as well. Medicare may cover medical treatment. Medicaid may help with services Medicare does not cover. Together, they demonstrate how different parts of America's healthcare system overlap. The bottom line, Medicare is one of the largest and most important healthcare programs in the United States. It provides coverage for millions of Americans and has become a familiar part of retirement planning. But Medicare is not a single government insurance plan. It is a system built over decades, combining federal rules, private insurance options, private healthcare providers, and personal decisions. Understanding Medicare helps explain one of the larger challenges in American healthcare. The debate is often presented as government versus private healthcare. The reality is more complicated. America's healthcare system already contains both. Before we decide what healthcare in America should become, it helps to understand what it already is. Medicare is one more piece of that puzzle.